Hello, so today we're going to be doing supine groin, So this is, some folks have heard of the tower. This is kind of a way of doing the tower when you don't have that piece of equipment, kind of a do-it-yourself tower, right? So this is a way of releasing the hips, a way of achieving some of the benefits of the tower without that piece of equipment. So what we're going to do is get into this position. So we're going to get your right leg up on the block into that static back position. So at home, you can use a chair, you can use an ottoman, whatever it may be. We want that right hip at 90 degrees and that right knee at 90 degrees. And we want that high enough to, if it's too low, that leg will tend to fall out quite a bit. So we want that high enough to keep that in that passive position, in that relaxed position, but still pretty straight. And then with this leg, with this left leg, we're going to have that straight and we're going to have this propped up. You can use at home, you can use a book, you can use the edge of a couch, you can use a weight, a dumbbell in this case. But what we want is, we want this leg fully passive, fully able to relax while staying straight. We want this leg to be straight from hip, knee, ankle. Toes pointed straight at the ceiling. We don't want to hold it in that position. We want it passively in this position. So it's being held artificially in this position of alignment with the other hip in flexion. And this left hip is going to release over time here. This left iliopsoas is going to release over the next period of time. This one takes a while. Sometimes I'll give folks a time frame for it, maybe 15 minutes each side, but ideally you would just wait until the hip is released and then move on to the other side. And that could take up to an hour. It might take 10 minutes, might take 15 minutes, but it could take up to an hour. So when you start this exercise, you're going to notice that, you'll probably notice that your left lower back or your lower back, perhaps both sides, perhaps your left side, is lifting up off the floor, right? And over time, that's going to release. That's going to start to relax into the floor. The iliopsoas, which is what we're releasing here, this primary hip flexor muscle group, is connected. It connects from the femur, the thigh bone, through the pelvis onto the spine, onto the lumbar spine. So when we release that, we get ramifications of releasing this hip flexor up and down the body. So we get really significant mileage by releasing the iliopsoas in this position. It seems like a very simple position. It seems like a extremely passive position. And it is from an effort perspective. But what we can achieve in this position can often be pretty significant. So you'll notice that when you get into this position, you'll probably notice that your lower back is up off the floor. And every now and again, just check in on that. Every 5 or 10 minutes, just check in if that lower back is relaxing towards the floor. Another way you can check on the progress of the release of this position is by squeezing the quad. So if you squeeze the quad when you first get into this position, you'll notice that you feel the center of the contraction lower down. For most people, it's going to be lower down towards the knee. As the iliopsoas releases, as supine groin does its work and the hip flexor releases, that center of contraction, where you feel that center of contraction, is going to start to move up into the meat of the quad. And it's going to start to move up towards the center of the quad, higher up the quad. So that is another way that you can measure, okay, the iliopsoas is released, this position has done its job. As you're going along, sometimes you're going to get some reactions. Sometimes you'll feel tension coming out of the hip. Sometimes you have little spasms. I'm going to insert a video of a recent client who was getting whole body spasms in this position. So you can get significant reactions. Sometimes there's no reaction at all. But either way, as this iliopsoas releases, as the hip releases, you'll tend to get really quite positive effects up and down the body.
Certainly not continuously.
Yeah, just sporadically through the...
I'll use this in clients with all sorts of symptoms going on, but where there is tension, where there is dysfunction, where the person's body calls for this exercise, and it's very common, regardless of the symptom might be in the neck. The person could have pain in the shoulder, they could have pain in the ankle, could have pain in the knee. All of these sorts of varied symptoms could still come back to hip dysfunction. So the hip and having it functional is really very important. A lot of what you do in postural therapy, you'll feel an effect straight away. Sometimes there can be a pronounced effect and you go, oh, whoa, that feels much better, or you feel more upright, or you feel some improvement. This one, you're spending quite a lot of time, and sometimes it is relatively subtle. But despite that, it's really good to pay attention to where the body was exactly before you did this exercise, and then pay attention to how you felt afterwards. Sometimes it is subtle. Sometimes it's just feeling that you're gliding over the hips easier. Sometimes it's feeling that the body can move more independently. Sometimes it's that you're not kind of lumbering as much in your gait. But that release of the hips and the release of other compensations that often go along with it can be really significant. So, pay attention, even if it is a bit nuanced, even if it is kind of subtle, pay attention. Oh, okay, do I feel a bit lighter? Am I walking easier? And if you are, then that's great. Keep going with that. Often the time that you spend in this exercise, even though it is a long time to spend, let's say you're doing it from a timed perspective and you're doing 15 minutes aside, half an hour total. It's quite a while to spend, right? But for a lot of people, that's going to, give pretty good benefits. And if they're doing that frequently, maybe daily for a couple of weeks, they're going to make a real difference in their hip function and in various other things, in their function of their whole body. So see what you can do to get willing to invest that time. Some folks just enjoy meditating or breathing, or some folks listen to an audio book or do whatever it is to be willing to sit in this position, allow this release to take place, and then reap the benefits. There is a variation of this exercise, supine groin. You can do supine groin with towels. Supine groin with towels. So supine groin with towels, basically what we'd be doing is putting a towel, or in this case a foam roller, underneath your lower back. So you're going to lift up your lower back. Good. All right. And then we're going to put one underneath her neck. All right. Good. So if you tend to have a C-shaped posture, a hunched posture, a posture where you're lacking that lower back arch, that curve that should be in the lower back, then this is one that can help encourage that, help put that there. This can help provide those arches to start to take place. So at home, you can get a towel, you can get a whatever it is, a blanket, whatever it may be, and you're rolling it up, not too thick, we don't want too much, just providing a little bit of support. So in this case, we'd be looking at maybe the towel being around about 3 inches and placing that under the neck and lower back. Okay, so that's supine groin. Once you've done 15 minutes on one side, so in this case, she's done 15 minutes on the left side, then we'd switch it around and do the same thing on the other side.